The emergency room at SSM Health in Lake St. Louis has reached capacity because of COVID-19. ER staff describe what it's like and call for all residents to help stop the spread.
We are currently working outside of this tent that I'm in right now. We are using these tents as extra beds as our capacity has increased due to COVID-19 pandemic, and we have run out of room in the emergency department. So we are utilizing this tent to provide patient care.
I'm going to be bringing people out here all day for the next 12 hours to sit in chairs where normally they'd be in stretchers inside so that we can take care of them just because we're beyond max capacity.
We are doing our best to provide patient privacy with our dividers between each section that the patients are receiving care in, but it's definitely different than our normal work environment. We're adapting as we can and making the best of everything that we can, the resources that we do have.
And this tent is to help with the volume that we're seeing, not just with our regular patients, but the COVID patients as well. We're having to expand the ER rooms into this tent and then other areas of the hospital.
It's very overwhelming for our staff, and it's scary as we have flu season coming up and we expect our numbers to increase as far as our patient volume every day.
My fear is that we're not going to be able to provide, patients the care that they need just because we are so overwhelmed with so many people coming in.
You just worry that people aren't going to get the care that they necessarily need. Whether it's COVID or if they come in here and they're having a heart attack. We're not having any visitors in the hospital. You feel bad for patients that are really ill and they've got nobody at the bedside that they know.
My coworkers are picking up a lot of shifts. Everybody's working really hard, trying to do their part, to get the community through this and to be there for our patients.
It's the same thing that we've all been saying since the beginning, but it's more important now than it has been this whole time. Our numbers are increasing every day, and we just urge you to take the steps to help not only yourself, but others in our community.
For folks that think that this isn't a thing, that COVID's not real, it's real. We see people all the time. We see people come in and they've got a fever and they're here for a few hours and they came in, they didn't need oxygen, and then their oxygen needs increase. They have increased shortness of breath. It's kind of scary for them. Just wear a mask. It's pretty simple.
As a healthcare worker, we take our steps while we're at work and when we're outside of work to try to prevent the spread of the illness in the community. And we just urge that other people also do their part. It's very sad when I walk into stores in the area and I see people not wearing masks, not social distancing. We're doing our part, and we just ask that everyone else step in and do their part as well.
Wearing masks, washing your hands, social distance, kind of what we've been talking about since it began. Don't go to gatherings for the holidays. That would be helpful.
I would urge people during this pandemic to think of others. Yes, I think that wearing the mask is very important, not only for yourself, but also if you were to get the illness, you could spread it to someone who, if they develop the symptoms, would be in a very critical condition.